The Transforming Cancer Care programme is a programme that describes a really major journey of change for Clatterbridge Cancer Centre. Many staff will be aware of the new Clatterbridge Cancer Centre building in Liverpool, which will open in late 2019. But the Transforming Cancer Care programme is much broader than the building, and really sets out a number of aims to develop our clinical services so that they remain sustainable for the future, and that we can continue to make sure that patients in Cheshire and Merseyside have access to the best cancer care for the future. The vision for Transforming Cancer Care is a really compelling one. As a specialist cancer trust, then delivering the best in cancer care for the patients that we treat and the people that we serve is absolutely fundamental to the mission of Clatterbridge. And Transforming Cancer Care is really about enabling us to do that and provide the most modern treatment for patients. Now, there's a number of different elements to the programme, a number of different parts of the programme, and they've all got their own specific aims. But really we want to make sure that whether patients are accessing chemotherapy treatments, radiotherapy treatments, blood cancer treatments, whether they're accessing care at Clatterbridge in the main hospital site, which will be in the middle of Liverpool, or any of the other sites in which Clatterbridge operates, that those patients have got access to a consistent level of cancer care, all delivered under the Clatterbridge brand right across Cheshire and Merseyside. The Transforming Cancer Care programme is a very big programme, and really we've broken that down into four main sections. Those sections are care for the future, building for the future, connecting for the future, and workforce for the future. And I'll just go through and say a little bit more about each of those in turn. Firstly, care for the future is the section of the programme that really describes how we'll organise and deliver our clinical services in the future, and how we'll change our model of care to make sure that our services are accessible as possible to patients. The first really visible change that we'll see in the care for the future part of the programme is the integration of blood cancer services into Clatterbridge, which will take place from the 1st of April 2017. The building for the future part of the programme deals with all the work required to construct the new and design the new Clatterbridge Cancer Centre, Liverpool, to organise the safe move in and the safe transfer of services and staff into that building in late 2019. But then beyond that, the significant investment in the CCC Wirral site and the CCC Aintree sites to invest in those facilities as well, and make sure that they're properly arranged around the service model that will be in Wirral and Aintree in the future. The Connecting for the Future part of the programme describes really the journey towards what's called greater digitalisation of Clatterbridge, using all of the modern technologies that are available to us to the optimal benefit of patients and staff. So we've already seen the first major milestone in this programme, which was the rollout of our new Meditech system earlier this year. There's a really detailed and exciting programme for the future that includes really the full development of an electronic patient record over the next couple of years, the development of a web-based portal so that patients will be able to access their own information about their treatment, the clinical correspondence about their care directly through a secure web portal. rolling out the technologies to support the greater use of telemedicine, for example. And last but certainly not least, we've got the Workforce for the Future programme, which is really a series of changes to the way that staff deliver care, the different development of new roles, so that the staff at Clatterbridge can work outside traditionally demarcated professional boundaries, and therefore for nurses, for radiographers, and for other members of staff, there are new and exciting possibilities around role development. That means that Clatterbridge really should be a great place for our staff to remain and develop their careers. Within the Workforce for the Future part of the programme as well, we're not losing sight of the really tricky issue of organisational culture and staff engagement, and those are really important parts of the programme, because it's very clear to me that there's a very special culture at Clatterbridge and that patients receive great care here, and holding on to all that which patients and staff find so special about Clatterbridge over this period of major change and a big move is something that we need to take very, very seriously. We know that our staff want and need more communication, more engagement about these changes. How we deliver that will all be part of the Workforce for the Future programme. You can expect to see increasing amounts of communication delivered in different ways. We've already started the honest conversation methodology. We need to go well beyond that. But really, for staff, if they care about Clatterbridge, which I know that they do, then really they need to be as involved as possible in these changes. So to make sure that we all together can make it a great success. And there's a number of ways in which staff can get involved, colleagues can get involved. If people are unsure about how best to do that, then please seek me out, seek any of my colleagues in the transformation team, the programme management office team, and we'll be delighted to work through how people can best be involved as individuals.